Good morning, I'm Nurse Guanipa. What's going on today?
Well, I haven't been feeling well, and I am noticing some abnormal bumps on my genital area.
What do they look and feel like?
They look like open sores and they ooze fluid too. They are really itchy as well, but I have been trying not to itch them.
Is it okay if I examine them?
Yes.
So what I'm noticing is that the sores are very characteristic to the sores that appear with the STD, syphilis. Are you experiencing any other symptoms?
Other than the itchiness, I have been so exhausted lately for no reason. My throat is sore and my lymph nodes feel huge.
And when was the last time you engaged in sexual activity?
I had sex 1 week ago with a new partner.
Okay, I'm so sorry to hear that you're feeling this way. What I'm going to do is perform a few different tests to confirm that you've contracted syphilis. To give you a little background information, syphilis is a common STD that, if caught right away, can be treated easily and quickly. If you hadn't come in so promptly, it would have caused much bigger issues down the line. When syphilis is left untreated, it can cause nervous system, brain, eye, and even heart damage, which is why it's so important to get treated right away. And if you were to become pregnant, there's a high chance that it would pass to your child or even result in stillbirth, which is when the baby is born dead. Fortunately, the success rate with treatment is high. All it is the dosage of penicillin, which will kill the bacteria causing the syphilis. Are you allergic to any medications?
No, I'm not.
Okay, perfect. So I'm going to conduct a few different tests to confirm your diagnosis. The first test I will conduct is a culture on a medium called McConkey agar, which is when gram-negative bacteria are put on the material, they grow. The bacteria that cause syphilis are known to be gram-negative, so if it grows successfully on this medium, that will be one check off the list of evidence to confirm the diagnosis. The bacteria causing syphilis is also microaerophilic, just meaning it needs little oxygen to survive. Therefore, the second test I will conduct is where a sample is cultured on a blood agar plate and then placed in a jar with a candle, and it's grown for 2 days. If there is growth, this test will confirm the fact that the bacterium is microaerophile. The final test I will conduct is called an antibiotic sensitivity test, and knowing that penicillin is the first choice of medication, we will place a culture of the sample on a plate with multiple antibiotics. Penicillin will be one of them, and if it does a well enough job of stopping the growth, then we'll know to use that antibiotic because it's proven to work.
Okay, thank you for explaining everything to me. Since I was treated, am I good to just forget this ever happened?
Not exactly. You should get blood tests periodically to ensure that you do not still have the infection, and you should notify your latest sex partner so that they can get treated as well. It also is recommended to get tested for HIV, as syphilis increases the chances of greatly contracting HIV.
Is it possible for me to get it again, or am I cleared since I get treatment?
Unfortunately, no, you're not cleared. If you engage in sexual activity with another partner who is positive for syphilis, you can most certainly get it again. So it's important to maintain honesty about each other's health with every partner you engage in sexually and to get tested regularly. Do you have any more questions? Again, I'm so sorry you're going through this, but it's great that you came in and got examined right away.
No, I don't have any more questions. Thank you.
Great. I'll call you in a few days with the results of the test, but do take the penicillin today. I will send the prescription over to your pharmacy, and I'm also going to recommend a great source online with some more information about syphilis. It's called mayoclinic.org.
Thank you. Bye.
Hi, Michelle. How are you feeling today?
Much better, but one day after taking the first penicillin pills, I felt extremely nauseous and achy, and I had a mild fever. It only lasted 1 day, but is that normal?
Yes, that is something called the Jarisch-Herxheimer reaction, which happens to some people after their first dose of penicillin. It's completely normal. In regard to the test results, the first test showed that there was growth, confirming the diagnosis that the bacterium is gram-negative. The second test also showed growth, confirming the fact that the bacterium is a microaerophile. And lastly, the antibiotic test showed that penicillin inhibited the growth of the bacteria. These 3 tests all supported the diagnosis of Treponema pallidum, which is the bacteria that causes syphilis. This bacterium is a spiral-shaped gram-negative and normally arranges itself in a ribbon configuration.
Okay, I am glad that I got treated right away.
I am too. That was very responsible of you. Be sure to follow up with those blood tests and always engage in safe sex. Any other questions?
No, thank you again. Bye.